Dr. Ajuadi is an expert and a world leader in imaging modalities to find locations in the brain for specific functions. So my involvement with him has to do with the treatment of epilepsy, creating MRI imaging modalities that we can locate the area of seizures in a multimodality fashion, which can help us in deciding what surgical procedure to do. He has been tapped by the World Health Organization to serve in particular committees in Geneva, Switzerland. He has worked with the Defense Department, Armed Forces. He works with all the national societies. So he is well known throughout the entire world. Hundreds of publications in peer-reviewed journals. It's tens of millions of dollars that have come to our community through FIU for research and education that are solely attributable to his commitment to research, education, and excellence, all for the benefit of our community. He has been very successful in developing work related to dementia, to Alzheimer's disease, to the pathology that we see in the brain. It's a complete lifelong commitment, which is, I think, truly a hero's position.
The work of Mary Bungay is really instrumental to our ability to engage into that type of clinical studies. Mary was working on Schwann cells, which are the cells in the nervous system that provide feeding to the nerve cells that are responsible for bringing movement and sensation to the entire body. It became very clear to Mary that her work would be very critical to the repair of the nervous system after, for example, spinal cord injury. And her work is so important that last year she was asked to actually become a member of the Institute of Medicine, which is the highest organization advising the President of the United States and the US government as it relates to medicine. Her work was really instrumental to being able to repair the nervous system. That type of accomplishment is really the reason why Mary is a healthcare hero.
Redmond Burke is a healthcare hero for his contribution to congenital heart surgery, for his innovations. He's the head of pediatric heart surgery at the Miami Children's Hospital. Dr. Burke was the first to apply endoscopic technique to minimally invasive pediatric heart surgery. And he's been an avid innovator and researcher since. One of his most recent innovations was when the children have pediatric heart surgery, a valve is placed in and the child continues to grow. So periodically, they have to be reoperated upon. There's a medical technical company that creates a membrane. So there was a little structure built with this membrane. That valve can grow with the child into adulthood without further operations. A lot of the work he's done in the realm of a telehealth system. Is a system that collects an unbelievable amount of data in real time. Well, when Dr. Burke arrived in Miami in 1995, he hired Jeffrey White to act as a technology advisor. And working with the heart team, the collaboration resulted in a relational database for congenital heart surgery. Information is now available on tablets and down to the level of an iPhone. It was the future of medical information technology starting almost 20 years ago. A lot of these things are happening in Miami. Trend-setting systems and techniques that is going to save lives all over the world.